For treating the vastus medialis and the rectus femoris on the front part of the thigh and on the inner part of the front of the thigh, take your foam roller, lay on your stomach over it, roll your body up and or down to find the tender points. After you find one, hold pressure there for 30 seconds, find as many as you can, hold pressure in all of them for 30 seconds, and then roll your body a little bit so the roller is now more on the inner part of the thigh, and do the same thing. And right here I actually have a lot more tenderness and quite a few more tender points. So here I'd probably spend about a minute or two probably treating all the spots that I find here for about 30 seconds each. After I'm done doing this spot, I would basically roll my body up and down by using my elbows to kind of dig in. You could technically use your other leg as well if you would like to. And then don't forget, if you treated any spots on the rectus femoris on the front side of the thigh, to roll yourself so you're facing straight down to roll this muscle out as well. I will admit a pet peeve of mine is when people come in and say they have a problem with their IT band, and I actually poke on it and the IT band is loose, and it is not problematic at all. And what they actually have a problem with is their vastus lateralis, which is one of the quadriceps muscles, but it's on the outside part of the thigh. And this can cause knee pain, this can cause hip pain, it can make you feel very tight on the side of the thigh. What you'll need to treat this is a foam roller. There's a lot of different foam rollers out there in the market. Price ranges somewhere between like $15 and probably I think about $40. If you say either one of those is way too much for you to spend and you're just willing to spend a few bucks, what you can do is buy a piece of PVC at least 3 inches in diameter up to about 8. If that is too aggressive for you, i.e. too tender, and you can't stay relaxed when you're doing this, what you can do then is wrap it up in a towel or in some carpet or maybe some carpet padding, and it'll make it feel a little bit less aggressive. If you wanted to, could you use, again, a lacrosse ball? Could you use a Theracane? Yes, I find a foam roller just works a lot easier. To treat the vastus lateralis, put the foam roller underneath your thigh, roll your body up and or down until you find a tender spot, apply 30 seconds of pressure, and repeat that until all the tender spots are treated on the side of your thigh. After you're done, roll your body up and down from about the knee area to about the hip. Now, you will not get everything if you just stay always in this single plane of motion in this muscle. What you'll need to do is roll forward a little bit better and possibly roll back to kind of search out all those little tender spots in the vastus lateralis, and most people have more on the back end of them. So if you just lie on your side and roll up and down, you will miss them. But search forward, search by rolling back, by applying that pressure for 30 seconds each on any of those spots that you find it. And then when you're rolling, make sure you roll on all the different parts of that muscle as well to make sure you change that blood supply to flush all those chemicals out of that muscle that you don't want in there. To treat the hamstrings, realize that they connect from your ischial tuberosity, right here on the bottom of the buttock. You can feel the bone that pokes out, and on the bottom part of the pelvis, to the knee, on both the inside and the outside of the knee. So to do a trigger point release on this muscle, you have to be aware that anywhere from the butt crease, the gluteal fold, to the knee area could potentially have trigger points. And not just right down the middle, but on the inside and the outer portion of the back of the thigh. So for this, you do the technique in sitting. You'll use a ball. I have a hard ball here. A lacrosse ball also works well. This is a technique that you have to be very diligent with making sure that your leg is relaxed. The hamstrings do so many different motions between flexion of the knee, a little bit of rotation at the knee, extension of the hip, you can easily use the hamstrings and not be aware of it, which means this treatment will not be effective for you. So I'm going to take this ball while I'm sitting on a firm chair, and I'm going to put it on or very close to that ischial tuberosity, that bone on the bottom part of my hip. And I'm going to just kind of move my body around a little bit. And I already found a tender spot, so I'll just relax here for 30 seconds. After you're done with each spot, if you would like, one option that you have to increase the blood flow and improve the circulation to this area is to do a technique where you basically lengthen the muscle while you're applying this pressure. It's like a pin and stretch technique. So as I'm still keeping pressure on that ball after the 30 seconds is up, I'm going to straighten my leg, and I can feel tension developing there. And you're going to do 5 or 6 times where you kick your foot up in the air to try to improve that specific area. Because this tends to be fairly uncomfortable, if you prefer to, after you're done with this technique, hitting all of the tender spots from the top of the thigh down to the knee on the back part of the thigh. You can also do a massage. Again, because of the fact that this muscle bends the knee and also extends the hip, it can be hard to keep this muscle relaxed. So typically when I see people with the foam roller underneath their thighs and they're rolling themselves back and forth, usually they're digging in with their heels or they're trying to extend their hips. And they're basically tensing up the muscle that they're trying to relax. So what you can do, again, with the ball, after you're done doing all those spots, is, I was in a crease in the table. You can basically just kind of roll yourself back and forth, up and down the length of the back of the thigh. Move the ball if you need to. And just like I'm doing right now, because the hamstrings can be so wide from the inner portion to the outer portion of the thigh, make sure that when you've got that ball for the trigger points, you kind of move your body all over on it. I found another spot right there. And you'll find some trigger points that you may have overlooked if you just search a large enough area. The hip adductors. If you're trying to do the splits, you need to have very good mobility in the hip adductors. They connect from the pelvis to the inner part of the knee. They're responsible for several things. They're responsible for turning the knee inward. They're responsible for controlling the leg so it doesn't get spread out to the side too far. Sometimes they're in spasm because they're trying to protect the hip. Other times, you're using them to actually pull the leg in from being out to the side, like if you're walking on a hill. With that said, I found that the secret to treating this area is actually to treat those, but treat them in conjunction with the obturator muscles. Now, the obturator muscles live on this bone down here. Now, I'm trying to face Gary right here square on the computer. Now, this bone down here is on an angle, the ischial tuberosity. I'm going to put my finger on the bone so you can see it's angled inward at the front. Now, what you can do is either use a ball like a lacrosse ball or a golf ball, or you can use a piece of PVC, about a 1 to 1.5 inch diameter piece of PVC, cut to about 6 to 8 inches plus or minus a little bit. If you're using a golf ball, you have to have a very small bottom. A lacrosse ball will work for most people in Wisconsin, I found. But basically what you're going to do is either sit in a firm chair on that PVC with it lined up on the outside part of this bone for about 2 minutes, and then you're going to move it so it's on the inside of this bone for about 2 minutes, which you can't really see, but you want to get it aligned right with that bone and just sit on it on a firm surface. If all of your chairs in the house are padded, what you can do is put like a small board down, something like that, maybe a book on a chair, and basically that'll help it kind of sink into those muscles a little bit more. But one time on the outside for about a minute or two, one time on the inside of that ischial tuberosity for a minute or two, or again, you can treat it with a ball, and then afterwards, as I'm going to show you with both of these, you can treat those muscles on the inner part of the thigh. So the first part of this is not going to be too exciting. I'm going to basically release the obturator muscles. First, I'm going to take my lacrosse ball. This table is padded but fairly firm. It'll work for this size ball for the size of my rear end. I'm going to put it directly on that ischial tuberosity with light pressure. And then what I'm going to do is I'm going to roll my body a little bit off to the inside, so the ball's on the outside of my ischial tuberosity, and I'm just going to sit here and hang out for 1 to 2 minutes. After I'm done with that, I'm going to again move my weight lightly so the ball's directly under my ischial tuberosity. And then I'm going to slip my hips to the outside so the ball's on the inside of the ischial tuberosity, and I'm just going to relax here for 1 to 2 minutes. After you're done with this, you probably will immediately feel as if your hip mobility for opening your hips up to the sides is better. But if you follow this up with treating your hip adductors like I'm going to show you, it seems to work a lot better. So for this, again, you could use a ball. I find a foam roller that works a little bit better. What you need to do is lie on your side. You're going to bend your top knee up like so. You're going to put the foam roller under your treatment thigh. And you're basically going to roll your body forward to find the tender spots and or roll it back. Now, just like with all these other things, it's important to make sure that you're relaxing the leg that you're trying to treat. So if you're rolling back and you can't put enough pressure on it to feel the tenderness, or you're rolling forward and to stabilize yourself, like falling off the bed or the table here, you're pushing down to make sure you don't fall off, it's not going to work. So you have to make sure it's relaxed. So get into a comfortable position. And if you need a pillow underneath your stomach to protect your back, there's nothing wrong with that. So find the tender spot, hold 30 seconds of pressure, roll a little bit, find another tender spot, apply 30 seconds of pressure. Allow your leg, the lower part of your leg, to relax down. Sometimes if you do that, you'll find another spot that you did not get to before. After you're done with releasing all of these spots, roll yourself forward and back for about 30 seconds to a minute. Change your leg angle a little bit so you're getting a different part of those muscles. Roll back and forth for about 30 seconds to a minute. And after that, those muscles on the inner part of your thigh should be pretty relaxed, loose, and they should work a lot better for you. And sometimes, because they can put pressure on the pelvis and cause back problems, your back will feel better too. To treat the Popliteus, if you can, try to either get your leg onto a chair like this, or ideally cross-legged. What you're going to do is you're going to find your tibia, that inner leg bone of the lower leg, and you're going to run your thumb along it so you get fairly close to the knee, and you'll feel like a little bump there. On the back side of this bump is where the Popliteus lives. So if you're going to take your lacrosse ball that I have here, and you're going to basically apply some pressure in towards the middle and a little bit forward relative to your normal standing position. You should feel an ache sort of sensation. You might feel some spreading of pain like I feel right now down to your ankle. That's usually very typical. Again, I'll spend about probably one time here applying 30 seconds of pressure. Then after I'm done, I'm going to basically just kind of rub the ball around on this area for about 30 seconds to a minute.